Good morning, sir. For selecting our invitation for the awards. This is our what I'm going to present is COVID-19 Jagratha portal, Government of Kerala. Actually, this is a portal that is conceptualized and designed by District Administration for report by National Informatics Center and Kerala State IT Mission. And this was launched in Kozhikode district on 19th of 2020. As we all know, the first case of COVID-19 was reported in Kerala on 1920, and three students, that is three students from Wuhan, who had reached Kerala in that time. And the second phase of COVID-19 was reported on February last week, sir. Then, so following that, we thought that we knew that since a lot of passengers.
There seems to be a network issue.
Develop this platform, sir. And can you hear me?
Dr. Vidya, we are not able to see your screen or presentation.
We are also
okay,
not able
one second, sir. Actually, yes, sir. 1 second, sir. Actually, my internet connection is a little bit slow, sir. 1 second. I'll just share once more. Okay, I think now all of you can see my screen. So this was launched in Calicut district on 19th March 2020.
screen.
And before the COVID-19 Jagratha portal, our data regarding COVID-19 was collected through Google Sheets and Google spreadsheets and Excel sheets. Yeah, 1 second. Actually, I have shared, sir.
At least I can't see the screen.
It's shared, sir. Can other participants see the screen?
Sharma ji, can you see the screen?
No, sir. No, sir. It is not.
Yeah, 1 second, sir. 1 second.
Dr. Vidya, I'm sharing your screen. You please continue your presentation.
Yeah,
I'm sharing your screen. I'm sharing on behalf of your screen.
Yeah, okay.
I'm sharing presentation.
Yeah, okay,
please
thank you. Thank you.
Is it visible to everyone, sir?
Yes, now it is visible.
Perfect. Yeah, Dr. Vidya, you can proceed.
Yeah, okay, I'll just proceed. So initially the data was collected through Google spreadsheets and Excel sheets. And so since we know that many cases will be reporting from Kerala, so we decided to start this COVID-19 Jagratha portal, that is a digital platform for capturing COVID-19 data. And as we all know, data is the key, and if there is a single source of data, it will be easy to manage the diseases. Then we can do the full cycle tracking of an individual. That's starting from the entry of an individual, that is either through domestic airways, or from the through road by interstate borders, or through international airports. From starting from there to their completion of the quarantine, and also from the release of quarantine, that full cycle tracking of an individual can be done through this portal. And then information regarding the COVID-19 status is made available to the persons at all levels. And then there is an integrated workflow for all authorities. This portal is not only for the government health officials, but also for the public and also for the other departments. And from the data, that is the information that is derived from the data, it can be used for decision making. And there is agile development portal, like as and when needed. Initially, we started with the transit platform in the COVID-19 portal. Later on, we added the other modalities also into the portal. And as of 15, the users or the visits to the COVID-19 Jagratha portal is 1,44,09,149 visitors. And this is a comprehensive solution that is for real-time surveillance, care and support for COVID people affected and quarantine for COVID-19. And it's a one-stop platform, as I said earlier. There is an information system that is that we can get the data of the international passengers, domestic passengers, and also the people in surveillance. And then there is a communication system that is the public through the public services that is being offered in the COVID-19 portal. The public will know that the e-pulse that is generated through the COVID-19 portal, and it is being given to the passenger. And also will get the people, passengers, and also the people will get an information regarding their test status, like whether they are released from quarantine, etc. Then there is a transaction system. In this, like, other agencies like ambulance services, then shops and establishments, they also can register through this portal. And another one is the management system, through which we can, like I said earlier, that
Can't hear her.
can you all hear me? Actually, I'm having a very bad internet connection over here.
No, I can, now we can hear you, but your screen is not visible.
Nikhil,
There's something going wrong. The screen is not visible now.
yeah, actually, Nikhil is Mr. Nikhil is sharing the screens. Like I have internet connection. So, Nikhil,
Now
can
it
you
is-
please share the slides?
Now it has come back.
Yeah. Okay, sir. Thank you. So next one is the management system. Through in this, we can do the patient management as the portal has got a hospital module. Then also the shops and establishment also can register their establishments, and can track people who are visiting those shops and establishments. And then from the whole information that is available in the COVID-19 Jagratha portal, we can come to a decision regarding the policy changes that can be taken time and when, as and when needed for the management of the COVID-19. And these are the health components of the COVID-19 portal. Then there is facilitation for inbound and outbound passengers, that is both domestic and international passengers. That passenger manifest that is available from the international airlines, and the domestic airlines is populated in the portal, and that is available to the health team and the data entry operators that they are posted at the airports, both international and the domestic airports. So most of the details that is collected in this is self-declaration by the passengers themselves. So only thing that we need to enter at the portal of entry is whether they are admitted to the COVID hospitals, whether symptomatic, and whether they are admitted to the COVID hospitals in their respective districts. So by this way, we can track the persons once they arrive Kerala. Then there is the travel to home and COVID care centers. Since we have ambulance services integrated in this portal, as and when needed, this passengers that who are being transferred to the home quarantine and also care centers are made available to this portal. Then the daily health monitoring and surveillance. In this, individuals, the medical officers of that particular institution, because this is a real-time data entry, So the real time only, when a passenger arrives at the port of entries, the information will be known to the local self-government and also to the medical officers. So once the passenger arrives at their home or the COVID care centers, medical officer who is in charge of that particular area can do the health monitoring and also the surveillance. Then there is a facility for teleconsultation. That is that person who is in home quarantine can themselves do their they themselves can declare their symptoms if they develop any symptoms, and they can do video consultation with that particular medical officer, and that medical officer can do e-prescription and also can do referrals, and all this can be done online. Then test and results of that particular person can be marked in this. Then also contact tracing, contact marking, that primary and secondary contact marking and also tracing can be done. Then there is a module for the hospital and CFLTC, that is COVID First Line Treatment Center Management. And in this, the junior doctors, once the patient is symptomatic and is being referred to the COVID hospitals or either to the CFLTCs, that we admit category A patients into the asymptomatic and category A patients to the CFLTCs. So when patients are admitted to the CFLTC or category B or C patients to the COVID hospitals, junior doctors who is given the username and the password can do data entry regarding the patient conditions in the COVID portal. So everything is real time. So at a particular point of time, we can have access to all these things. Then there is ambulance management. Even we know that all the ambulance that is running in a particular district can be registered in this portal, and we will know real time that where the ambulance is located. Then there is a visitor register that is for the passengers and also for the public who is registering, and also for the hospital visitors. Then there is a COVID brigade. Since we, as of all of you know, that we have a very high number of cases reporting during this time, like starting from July onwards. So we have formed this COVID brigade. That is any person who is willing to participate in COVID related activities, they can register in this portal, and they are called as COVID brigades. Anyone who is a medical or non-medical person can be registered, voluntarily registered in this COVID portal. Then we have also integrated monsoon preparedness and reverse quarantine in this portal, because since we have a more than 6 months long monsoon period, and it also coincides with the COVID-19 outbreak. So, and most of the areas most of the districts in our state are flood prone. So this also can be, we can identify houses. When we do the house visits, we can identify houses which have been flood affected in the previous years. We can mark those houses. And also reverse quarantine, that is people above 60 years and with comorbidities who needs to be reverse quarantine also are managed through this portal. And these are the citizen services, that is visitors entry, that is the domestic entry, international entry, a separate portal for the migrants, then short or regular visits. And a person who are willing to visit, who is coming to Kerala for more than up to 7 days, they are given they can be registered, then they are given an e-pass. And then there is a self-declaration, that is whoever is entering, they can declare their health status, whether they are pregnant, whether they have children less than 3 years, and all those things. Then they can report the health symptoms. Then when they are released from quarantine, and also they can upload, they will get access to their test results. And citizens can also give feedback reporting any offense that is committed by the field staff or any health staff or anyone. And also they can give complaints and requests also through this portal. Then there is an account for each individual will have a separate account once they register in this portal. And this is for the business owners. They also have a visitor register service, specifically for the business owners. And then a boat and vessel registration, because some of the areas, especially in Alappuzha districts, they are accessible only through the boats or any small vessels. So they also can be registered, and they also can be made use for COVID-19 activities. Then vehicle transit, anybody who's coming through the 6 interstate borders of Kerala, they are given vehicle transit. Then shop and establishment operations. In this, since we had many clusters at the market areas, and it is difficult to do contact tracing in that when there is a COVID-19 cluster in market areas, we have started this shop establishment operations. In this, all the shop establishments in a particular market can be registered in this COVID portal, and they can register the people who are, they can do the, what do you say, do the data entry or whatever. They can register the people who are entering their particular shop and establishment. And once there is an outbreak in that particular market, we will be able to track the people who are coming, who had come to that market on that particular area. And also we can do the vehicle transit renewal through this. Then another thing is this is joint hands. We, like I said earlier, this is COVID brigade registration can be done. Then ambulance provider registration. Then Sannadha Sena registration. This is the voluntary organizations who are willing to participate in COVID-19 activities. They can also do registration. Then and we can do analytics centers. Then there are dashboards, separate dashboards for the surveillance, then visitors, public, etc. Then there is general information given that for the COVID-19. These are the COVID Jagratha dashboards. This is for the permit and passes, then transit, then surveillance, COVID care centers, test and contacts, ambulance, hospital and CFLTCs, containment zones. From June onwards, we had started reporting clusters. As of now, as today, we have around 370 clusters in Kerala, COVID clusters in Kerala. So these clusters, clusters can be, what do you say, containment zones are COVID-19 activities. Control activities are done in these clusters after declaring them as containment zone. So even the containment zone marking can be done through COVID-19 portal. And this is a separate dashboard for COVID clusters, then COVID brigade and visitor register. These are the users that the number of users that had been through the COVID portal. The passes and permits issued. Domestic registered is 1,16,02,309. Then is domestic entry crossed 6,07,297. International registered 87,222. International entry point crossed, that is 3,71,503. Emergency travel passes 1,22,948. Emergency travel passes 1,22,948, and a volunteer pass issue 62,245. Volunteers registered 3,04,399. And these are the originally quarantined people in the surveillance.
Dr. Divya, you have 1 minute left. I request you to conclude, please.
Yeah. Okay. So, okay, sir. These are the numbers that I would like to project. And as of 15th, 15,734 people had registered in COVID brigade. And out of that, 7,061 were medical professionals, and non-medical staff, 7,673. These are a few of the points that I would like to add for COVID-19 Jagratha portal, sir. Thank you for the opportunity. Thank you, sir.
Dr. Vidyaji, this is a very comprehensive
Yes,
portal you have developed. I think you have integrated each and everything, entire
yes,
supply chain, and you have integrated in this. With the help of which organization you have developed it?
That is NIC, sir. National Informatics Center and Kerala State IT Mission, sir.
IT missions. And now it is well established. There is no technical
Yes, sir.
glitches.
It is very, yes, sir.
When did
No,
you
sir, no technical glitches. Actually, we started on 19th March, sir. 19th March, actually, it was started before the India portal and the Air Suvidha by Government of India, sir.
Very good.
And,
Thank you, sir.
and when, I mean, the numbers which you have mentioned, they are primarily for registered brigade and for probably the ambulance visits and so on. So
Yes.
it seems that some services were functional earlier than others. Are all services functional now?
Yes, sir. As of today, all services are functional. Initially, we started with the transit, sir. First, we started with the transit and surveillance. Then we went on adding the test and contact. First, we started transit, then surveillance, including the contact tracing. Then we started the testing. Then later on, the COVID brigades, sir. Ambulance and COVID brigade. COVID brigade is the last one to add into the portal, sir.
How did you do contact tracing on the website?
Actually, what we do is that contact tracing, once the passenger enters their home quarantine, enters their home, and once that person is tested positive, that results will be available to the district surveillance officer and and also to the medical officer in charge of that particular area. So that medical officer in charge of the peripheral health institution, they visit the person directly to their home, and then they start doing the questionnaire, oral questionnaire, and then identify the people, that is primary contacts and secondary contacts. They get a list of that, and either the medical officer in charge or the rapid response team, that is comprising of the field staff, that is multi-purpose workers, or the DSOs, directly the district surveillance officer, they can do the data entry in the portal for the contact tracing, primary and secondary contact tracing.
You did not use the call data records of these people?
Yeah, that also we can do, sir. That also we can do, sir. Either through home visit or through phone calls, we can do the contact tracing, sir.
And you have mentioned that this portal also takes care of the incoming passengers, the international passengers,
yes,
and outgoing passengers. And
yes,
so that data entry is done at the airports.
That data entry is done at the airports. Actually, like most of the data will be entered. Like we received this COVID-19 Jagratha portal team receives the passenger manifest from the airlines, and that also by the Vande Bharat mission. And then even all the people who are willing to enter Kerala, they have to, in addition, they have to enter the COVID-19 portals, Jagratha portal. So that is all the international passengers and all the domestic passengers. So both data is collated at the portal at the time of the entry. Means when a flight arrives, this passenger manifest with the self-declaration of the passengers will be available to the people who are sitting at the point of entries in the airports. That this usually the data entries posted by the revenue department. So this can be this is made available in their laptops when like depending on the name when they type the name of the flights. So only the last three columns, that is whether the person is admitted to the COVID care center or COVID hospital or to the CFLTC, will be remain blank. So even the COVID care centers and home quarantine also can be entered as self-declaration. And once the health team does the health screening of the passengers, and if the passenger is found symptomatic, then only that entry is done at the airports. That is at the point of entries, either at the interstate borders also. And once that particular flight goes, this portal, this data, that Excel sheet that is made available to the data entry operators at the airports are uploaded to the portal. So that will become available to the DSOs then, and also to the state officials. And once that passenger reaches that point of entry, that real time that information will be given to the will be available to the particular medical officer in charge, depending on the home address, and also to the local self-government, that is LSGI secretary, Panchayat secretary also it will be available, sir. Because the COVID first line treatment center is under the jurisdiction of, under the control of the Panchayat secretary, sir. So if the person goes to the COVID care center or the CFLTC, that information will be available to the Panchayat secretary.
Okay, thank you.
Thank you, sir.
So thank you so much, Dr. Vidya. So now I'm going to run poll, that is peer evaluation, and that you can vote each and other's organization according to their presentation. So it will be popped up on the screen. I request everyone to vote for this project.